As a primary care doctor, the thing that I am most passionate about and maybe most known for in the office is lifestyle medicine and preventive medicine. I really like to talk to people about ways that they can make their health better over an entire lifespan. The other thing that I feel really passionate about is mental health and the way that that affects the entirety of your health and the rest of your life and your interactions with your family, ability to succeed, whatever that means to you. And then preventive care. So preventing things that we know we can prevent. It's hard to appreciate what is prevented, but we know that those things are the most meaningful. Nutrition and lifestyle changes can impact every single aspect of your health. This is such an important thing to talk about and that we need to take time to talk about. The thing that I like to say is, we talk about medicines, we talk about vaccines, all these things. You take medicines once or twice a day, usually. Of course, there's different ones. And you do vaccines maybe a couple times a year. You put food in your body 3, 4, 5 times a day. And so thinking about what you are fueling your body with is so important, and it affects every aspect of your health. And then other lifestyle changes, something simple as adding in some movement to your day every day, we know improves your heart health, your brain health, your mental health. And I can't think of much more important interventions than that. As a family medicine doc, I really focus a lot on this lifestyle piece and setting goals. And the main way that I do this with people is I lead them. I do not tell people what their goals are gonna be. So I will help facilitate that conversation, of course, and usually people start identifying things that they know they need to change. And then I ask, okay, what's reasonable to change before our next appointment? And how do you want to do that? And then I start drilling down and I ask for specifics. I think most of us are familiar with the SMART goals. And I like to use that. So they have to be specific goals, they have to be measurable, they have to be attainable, they have to be realistic, and they have to be time bound. So that's the SMART goal. So it can be simple. It can be, I'm going to walk for 10 minutes, 3 times a week, every week for the next 4 weeks. Simple. Not easy, but simple. The main lifestyle intervention that comes to mind for preventing or managing chronic conditions is diet. It's a tough thing to talk about, tough thing to change, but moving toward a whole food, plant-based diet, getting all of your nutrients from real foods is one of the best changes that people can make for their health over a lifetime, including for conditions they may already have.